The Living Well framework and document was shaped through engagement with a wide range of stakeholders. We had an open space event where several hundred people got involved, and we also sent the information out for consultation as well. And people came up with these 5 or 6 areas really about the direction that we need to take. Fundamentally, we need health and well-being, living well on everybody's agenda. Public sector, certainly, voluntary sector, obviously, the community is probably already on the agenda, but private sector, businesses, independent sector, we need to be working in harmony on the living well agenda. We need to be investing and extending our years of healthy life and active life. We need to have public investment in communities that builds on our strengths and assets, raises aspiration, builds resilience, and releases the potential of all of us. Children, early years, key focus of Marmot and key evidence there about what we need to do. So ensuring the best start in life for those young ones in order to become healthy and well adults into the future. We need to tackle discrimination. That was a strong theme that came out of our open space. Building on Marmot, tackling social injustice and poverty. Obviously the evidence is huge there around the relationship between poverty and health and well-being. And then the environment, our places where we live, where we work, we need to make it easy, conducive to living a healthy life. Some of the things that align to living well that we've been taking forward over the last number of years. Firstly, the investment for health agenda. This is part of a wider World Health Organization initiative, and we've been doing some work in the Northwest to build a framework for investment in health so that businesses, organisations can look at what they're investing and that it has maximum impact on health. Again, reducing barriers to ill health and looking at health impact assessment. And there's a document there that you can download if interested. That's been taken forward in the NHS through social value, and there's a new accredited scheme for NHS organisations in the Northwest that focuses on the investment for health agenda, and a foundation for social value was launched by Mike Farrow last week. So it's looking at sustainability of the organisation, worklessness in the community outreach and engagement, and how we procure our services, where from, who from, locally, and where we're commissioning from. And again, you can download a tool there and guidance on investment for social value, similar to social return on investment. There's the 5 ways to wellbeing that I mentioned. I'm sure some of you are already using those. There's been some great examples of people using those with individuals in our individual contacts, in health and social care services, and also with communities in community discussions, and also actually shaping our strategies and policies as well. How can we tackle the well-being through these 5 areas? They were drawn together by the New Economics Foundation as part of the government's foresight report into mental capital and well-being. And the evidence was considered on what are the public messages that will improve well-being. Connect has probably got the strongest evidence for well-being and potentially for health as well, for all health. Connecting with others is a very big determinant, with our family, with our friends, colleagues, and also just with our neighbours day to day. Being active, physical activity, taking notice of what's going on in our own lives for ourselves, reflecting on things, but also taking notice of our wider surroundings, the environment, looking at nature, reflection. Keeping learning, lifelong learning, right throughout life is key to our well-being. And giving to others, doing something for somebody else, volunteering, etc. is good for our well-being. The 5 ways to wellbeing are being used as a focus for the year of health and wellbeing. This started this year in Liverpool, Merseyside and across Cheshire, and we're taking that into the whole of the North West next year. We're looking at building on the 2012 Olympics and looking if we can have 2011 as a year of wellbeing, moving into that focus on physical activity. The goal is to get everybody to be aware of the 5 ways to wellbeing and to use those, to adopt the 5 ways and adapt them for themselves and their own families. Looking at changing public sector services as a chance to build on that approach to wellbeing, building new partnerships, working around the responsibility deal with business and voluntary sector, and also a big society of engaging communities and empowering communities. So we hope that all organisations in the North West will come on board with the year of wellbeing and indeed start to look at that as a whole decade of change. And so we're also starting to talk about a decade of health and wellbeing. What can we do in public services as well? Well, we need a new approach there as well. Planning, decision making, looking at public priorities, community assets, our investment in environment, green space, support into work, joint service delivery, looking at our primary care, community-oriented primary care, the social value, and looking at a prevention and a treatment service as we go forward. We're doing some work around wellness services, supporting people to live healthy lives through the services that improve their lifestyles, but also looking at the psychosocial factors that underpin our healthy lifestyles. Potentially shifting a focus around from what people are doing, smoking, drinking, and looking at why are people actually doing that. And it's something we've not done enough of in the past. The public get sick of negative messages about what not to do. The Living Well is a good opportunity to focus on what to do. The 5 ways to wellbeing bring that. But we're needing to understand why some people aren't making healthy choices and what is underpinning that. We all know getting home from work, why do I have a glass of wine? Why do I feel I can't make it to the gym? It's how I feel. It's kind of, how am I feeling tonight? Am I lacking self-esteem? Am I bored? Am I stressed? Why are we making those choices? So needing to understand that a lot better in order to advance the Living Well agenda. Asset-based working, I've mentioned this. It's something we need to do with communities as well as with individuals and services, as well as our joint strategic needs assessment. I've used a quote there from Marmot, Rise Up With Me Against the Organisation of Misery. We talk about living well, but over the last year I've still seen joint strategic needs assessments that are focusing on deficits, problems, disease, and you often get a good picture of a place that's, well, we've got this high teenage pregnancy rate, high alcohol problems, high hospital admissions, etc., etc. And it's actually, can we turn that around? What are the positives going on? Where is health working well? Where does it exist for whom? What's going on in the community? What facilities are there in the community that create the conditions, the resources for health and well-being? I mentioned undertaking a survey this year, or last year actually. It was the data was collected and it was published earlier this year. We surveyed 18,500 people in the North West looking at their well-being, and it's provided us with new data. We've measured mental well-being through our suicide rates in the past. They tell us something. They tell us about suicide. Doesn't really tell us how mentally healthy we all are. So a lot of people were needing to look differently at how are we measuring whether our population is mentally well. So we've got an important new baseline. We have some comparability across localities, and we've certainly got a better understanding now of mental well-being, its determinants and its relationships to other factors. that's how the distribution looks. We measured a range of things. We included the Warwick Edinburgh Mental Wellbeing Scale, which was a newly validated score for populations. It's kind of the only really good population measure that's positive wellbeing. And we also measured social capital, relationships, life events, health lifestyles, social care. And so we've got a mean score, and we were able to divide that up into high and low wellbeing. Marmot also calls for us to have a better measure of wellbeing across the population, so we're certainly using this evidence in the North West that we've done this to shape our Living Well framework. This same survey instrument is being used in the Health Survey for England this year, so that'll give us another good comparison across the whole of England. We also have one for Scotland that was done a few years ago. I'm not sure you can see that from here. The blue line in the middle is the North West, so that's our average score across the region. Not sure what was going on in Warrington. We've got a bit of a spike there, and then Liverpool at the bottom. And Central and Eastern Cheshire is 2 up from the North West. So the North West mean is 27.7, and you're a little bit higher with 28.34. If you've not seen this before, there is a report you can download, and you've also got all the data for Central and Eastern Cheshire. So in probably the PCT have got hold of that, or the council, and that's probably something you would want to look further into to understanding why you high and what are the aspects that you can learn from around inequalities in wellbeing.